Bone marrow morphology is part of the diagnostic criteria of essential thrombocythemia. Most recent update on it by Teferi, Vannucci, and Barbui. These are the major criteria. So your platelet count, the bone marrow megakaryocyte proliferation and what it looks like, absence of fibrosis, and not meeting the criteria for other myeloid neoplasms, including PV. So myelofibrosis and PV are the two main things in our differential diagnosis when we suspect somebody has essential thrombocytosis because their platelet count is elevated. So to make the diagnosis, you need to meet all four major criteria, or the first three and one minor criterion. These are the minor criterion. So another clonal marker is present in the bone marrow, evidence of reactive thrombocytosis. That is from a 2024 article, but the criteria have not really changed that much since the last WHO update in 2016. It's cut off at the top, but that's where this came from. Again, platelet count, bone marrow biopsy showing proliferation of the megakaryocytic lineage, more about the bone marrow findings, and again, not meeting the criteria for the other things on the differential, and minor criteria, again, presence of a clonal marker, absence of reactive thrombocytosis. This came from another article from 2015 written by Dr. Barbui prior to the 2016 WHO criteria being updated. Some reasons why a bone marrow biopsy might be omitted in the initial workup would be patient preference. Patient strongly doesn't want to undergo an invasive procedure, and at the time of diagnosis, the bone marrow findings may not change the recommended treatment. And that's because early phase MPNs in some patients may not require any intervention.